I've never seen a chain reaction.
Right. No, I have never seen a new president root for the old president. Like, he did good on this. I've never seen it.
Never.
Because let's be real, regardless of which party you are affiliated with, regardless of how you vote, each president has done something that has done good.
What's good, y'all? It's the Demouchets React, and we're back with another video. Who we got today, C?
Today we're back with another American reaction. We're super excited about this video, guys. If you're new to us and we're new to you, make sure you scroll down, hit the red subscribe button, and turn on the post notification bell because we're on the road to 50K. And we cannot get there without you. So join the family. Without further ado, let's get into the video.
Healthcare is becoming a big issue in the 2020 elections. The Democrats are pushing for a government-funded model, while President Trump is campaigning on gutting Obamacare.
We repealed the core of the disastrous Obamacare. The individual mandate is now gone.
Medicare for all has become a mantra among left-of-center Democrats in the presidential race.
Healthcare is a human right, not a privilege.
I strongly believe that we need to have Medicare for all.
I don't know what it is though. Like with the presidents, they always come in. Everyone tries to come in and they want to move things around. They can never all just be on the same page. Like if you guys are all on the same page, don't you think a lot of things will just work way smoothly?
Right. Nothing the previous president has been correct in the way it should be.
I've never seen a chain reaction.
Right. No, I have never seen a new president root for the old president. Like, he did good on this. I've never seen it.
Never.
Because let's be real, regardless of which party you are affiliated with, regardless of how you vote, each president has done something that has done good.
Right.
Regardless of how you feel about that person, regardless of anything, they have done something, one thing.
Yeah, you can pick it out. Yeah.
Right. Now, if you one of those people that's like, this person didn't do this, you need to go do a reality check about yourself.
You the problem.
A character check. Yeah. Right. Because even though, we react to some tough stuff sometimes, but we always try to find one good thing.
Essentially a universal single-payer system, closely modeled after Canada's healthcare system. But there's another national healthcare system that gets a lot of attention: France. Back in 2000, the World Health Organization ranked it as the best national healthcare system in the world. A lot has happened since then, but France's healthcare system remains a model for universal coverage. Here's why. Despite spending less on coverage, France has comparable or even better healthcare outcomes than the United States. Okay. The United States has a higher rate of infant mortality. In France, nearly 4 children die out of every 1,000 live births. In the US, that number is closer to 6. France also has a higher average life expectancy than the United States by 4 years. And the rate of rehospitalization in France is 5.3% lower than that of the United States. Lower rates of rehospitalization in France are likely due to better access to primary care, as well as longer average stays in the hospital. Since France gives every citizen coverage from birth, the system allows them to get more preventative treatments throughout their lifetimes, which save on costs and improve outcomes. After World War II, French politicians were concerned the country's private healthcare system would not be able to handle coverage demands. So the country established a model of national health insurance, meant to protect the population against increasing healthcare costs. The French call their system social security, but it is not an example of socialized medicine. It's not government-run, just government-financed. It's very close to being a single-payer healthcare system.
I'm Pierre Lopar. I'm a professor of economics at the Paris School of Economics. Every individual who lives in France, whether he or she is a foreigner or a French citizen, is covered by basic social security. Everyone has access to care.
Everyone.
Free access to care, but access to care with reasonable co-pays. So
This mandatory coverage doesn't come at the expense of freedom of choice in medical care. The system is set up to ensure that doctors are not restricted when making medical decisions.
The system covers every doctor, every lab, every hospital, every clinic. They're all covered.
That's big.
And they all have to take the patients.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
America's the only place where we have what the insurance companies call narrow networks, where they dictate which doctors you can go to. No other country does that. In every other country, the patient picks the doctor and the system pays. That's also true for our Medicare system. Medicare covers all doctors. So here's what happens in the United States. Let's say somebody, a clerk in 7-Eleven or hotel maid has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. It would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. Right. And 3 months later, she's in the emergency room with a burst appendix. It costs $60,000. And we'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100 instead of $30,000. The way we do it, by definition, makes things much more expensive, because covering everybody so that people get the care they need when it's still early and cheap is a much smarter and a much less expensive way to provide health care.
France's Social Security reimburses around...
Okay, so first, I love that they call it Social Security. Because Social Security means along the same lines as this, but it's not medical here.
Right.
Second of all, having to find doctors, pediatricians, dentists, specialty doctors, all of that who are within your network is a pain.
Yeah, it really is.
Because
I agree.
I may let's say I start going to a doctor who I truly like, and have a baby with this doctor. I switch to a new insurance plan, and I want to stick with that doctor, but that doctor isn't in network with this new insurance plan that we have. So in order for me to stay with that doctor, I have to agree to pay thousands of dollars more just to stay with that doctor, or decide to build a new relationship with a new doctor and stick with that plan. So it's just a whole bunch of just
I like chain reactions though. Like, you get one doctor, you have your baby by that doctor, and then the doctor recommend another doctor that can help with the baby and with your needs as well, and then they recommend any therapies or any other buildings that may help out. You know what I'm saying? So chain reactions is good to have.
Right, definitely. It's just a pain. It would be great to just have all doctors in the same network, right?
Around 70 to 80% of medical costs, leaving the remaining amount for patients to pay out of pocket. France also has voluntary supplemental health insurance provided by private insurance companies.
But in France, they want you to know that you're getting something of value from the healthcare system, so they make you pay, and then everybody in France gets about 80% of it back from the insurance company.
France's Social Security also legally requires price transparency. And because the government-funded system covers the entire population, it has more bargaining power to keep the prices low. Social Security also has no waiting list for specialized hospital treatments. There's also no physician gatekeeping. French patients do not need their general practitioner to sign off so they can see a specialist. So how does France's system stack up against America's? The French healthcare system is considered one of the most expensive in the world, and yet it's still half the cost of America's. In 2017, U.S. spending added up to $10,200 per capita. In France, it was only $4,900.
What a gap.
Administrative costs are also much lower in France than in the United States.
In France, they're limited to 5.5% of the bill. Whatever the bill is, the administrative fee can't be more than 5.5%. In America, our private insurance companies have administrative costs of 20% on every bill, and that's so important to our insurance industry that their lobbyists wrote that into Obamacare, that they're allowed to add 20% administrative costs.
One of the ways the French keep their administrative costs lower is with the carte vitale, a health insurance card carried by every French citizen. When a person visits a doctor in France, they present their carte vitale so the doctor can look them up in a digital system. The card gives the doctor all the information they need to charge for the visit.
So at birth, every child, every individual, every person gets this card. Mm-hmm. They load this card up because they have one big system where everyone is using the same, systematic function to have Medicaid or Medicare, if I'm speaking properly. And they good to go. You just pop up to the doctor, you have your card in your hand, and you good. And then you get reimbursed 70 to 80% of that.
Right, and that's how we were feeling with our HSA card. Mm-hmm. Remember?
Oh yeah,
So HSA is a health savings account. So when you purchase your insurance, or if you're getting insurance through your employer, there's like a certain amount per what do you call it? Period. Medical period? I can't think of the
medical
name right
period.
Yeah, like
I get what you're saying.
The plan, insurance plan.
Insurance plan. Just say the plan.
The year.
Per plan.
Let's
go per plan.
Year. Per plan per year.
Per year. The PPP.
So you'll get like what, $2,000 or something on it. Mm-hmm. It depends on your plan, and that's how you pay with your copay throughout the year.
Right.
Imagine if we was getting this. We would like put it on the card.
Right. Swipe that. That's love. I like it.
Citizens can also opt to have all their medical records stored on a card for doctors to access. And because the system is available all over the country, it saves time and money. Another way France manages rising healthcare costs is by having the government regulate them. Unlike the United States, where legislatures are deadlocked on what to do about healthcare, the French parliament votes to set new healthcare budgets and guidelines.
See, so I'm thinking that because they have everything on, through one system with the cards, that the doctors, the nurses, all of them, they're getting paid more that way because it's more controlled. You know what I'm saying? Yeah. It's not that they're looking for a certain insurance policy to help them get paid, and they don't have to build. Like, they can literally build that one policy.
Well.
And get paid however much they want. Because remember, they can make their own check. They can control how much they get paid.
But they're not government run.
The government finance.
Yeah, so the government is funding them. So maybe it's like, a cap at how much the government can send to them.
That's why they're probably not getting paid much.
Right. So
it's not bad. They are getting paid good money, but at the end of the day, it's like I would expect in
comparison to America, they aren't.
I would expect them to get paid about what America's getting paid.
Right, or better. If they have the best of the best. Yeah. Here's
of your policy. They get their own. Because I hear we gotta, we don't just be born into our own policy. We have to be signed up. Yeah. Right? We gotta sign them up. Then we gotta get them into the office. And so the doctors know with the kids, they're going to get paid from a certain insurance. They know the insurance they're going to get paid from. But as for adults, everyone have their own.
Right, definitely. And I would love to, see our homeless community have access to more resources.
Oh, like this. Say that. That is big.
Automatically, not, them having to go see if they qualify for a certain program like medical insurance.
Right.
So I would love that.
That's big. Yeah. That was a
very good informative video.
That was a bar.
Yes.
That was a bar.
Yeah. So we hope you all enjoyed this video with us. Like this video, subscribe, turn on the post notification bell. We have enabled our super thanks if you would like to support the channel that way. And our join feature is now enabled. Our mailing address is in the description box below. We'll see you soon. Peace.